Hi, I'm Laura Halterman. I'm a DNP student at Brandman University in Irvine, California. And this is my innovation project video proposal of the mobile application Crisis Go. I'm going to go ahead and demonstrate how the Crisis Go app looks from my phone. I've created groups and circles. The groups are going to be team leaders and clinical.
New at 6, 10 News reporter Michael Chen reveals the size of the threat will be miles below the surface. Earthquake. Again, we get a major earthquake going off in Southern California right now.
Before dawn, a massive 7.8 magnitude earthquake shook the Southern California area into utter chaos.
5110, that is affirmative. Go ahead with your traffic.
California 5110, preliminary report with only of a 7.8 on San Luis. We have numerous reported injuries and deaths according to the local media. And again,
Yeah, we get numbers flying into the structure to the left. Any action or just keep.
That is how quickly disasters can happen. What constitutes a disaster? Disasters can be man-made or natural. Natural hazards are occurrences caused by either a rapid or slow onset events, which can be described as geophysical, like seismic activity, mudslides, tsunamis, and volcanic eruptions, hydrological, snow slips and inundations, climatological, life-threatening temperatures, droughts, and fires, meteorological, cyclones and storms or wave surges, or biological, such as pandemics. Man-made hazards are complex emergencies, conflicts, famine, displaced populations, industrial accidents, and transport accidents. These are events caused by people and consist of environmental degradation, pollution, and accidents. After 9/11, the United States was forced to reassess its level of disaster readiness. Healthcare organizations nationwide have had to examine their disaster readiness planning due to the heightened terrorist alert. As the chief providers of healthcare to the medically underserved in our country, they are vital to any effective disaster readiness effort. The National Association of Community Health Centers steered a disaster preparedness survey of all federally qualified health centers in October of 2003. The survey reached 705 health centers nationwide. 193 responses were received for a total response rate of 27%. The survey revealed that although 73% of health centers have disaster plans, only 9% feel adequately prepared for a disaster. Research on the perception, knowledge, and understanding of disaster response of emergency department nurses in a healthcare setting in South Australia showed that regarding disaster knowledge and experience, 87% stated they know where their ED disaster plan is located. 42% state they have not read their ED disaster plan, and 37% reported having been involved in a disaster or major accident. In regards to disaster preparedness, 45% stated they were less than confident in their level of awareness. 36% felt confident, and only 19% felt more than confident. 32% stated that they were confident in the level of preparedness of their EDs to receive and treat multiple casualties. 13% very confident to extremely confident. 45% felt marginally confident, and 10% had no confidence at all of their ED preparation to receive and treat multiple casualties. Regarding disaster education and training, 56% stated that every 2 years or less, their emergency departments have disaster training. 21% stated never or are unsure of how often disaster training is available. 39% have never attended disaster training or education outside of the workplace. 54% had attended courses with minimal disaster component, and 14% stated that they had attended disaster-specific courses. Future disaster education. 95% stated that disaster education for a nurse in the ED is important. 77% said that it is extremely important, and 18% that it is very important. 42% of the respondents believed that the form of disaster education or training that would be most beneficial was a multi-agency for real-time exercises. As the largest collection of healthcare providers, nurses are essential personnel during a catastrophe and can be instrumental in preparing the emergency department to respond to disasters. Empowering staff by providing them with the methods and structure to approach their jobs and other roles required during a disaster is imperative. While working on this video proposal, I engaged the collaboration of Shannon Welsh, Executive Director of Revenue Cycle Services, Dave Baker, Senior IT Technician, Christine Sloat, Emergency Department Manager, and Jim, Deputy Sheriff. Ms. Shannon Welsh was chosen for her expertise in financial and ethical issues inherent in the use of electronic mobile applications in the workplace. Also, as someone who can influence the widespread adoption of mobile information technology, specifically the Crisis Go mobile application in the facility, as she is one of the leaders of the emergency preparedness management. Mr. Baker was chosen for his experience in the subject matter regarding the technical and ethical issues inherent in the use of mobile and electronic applications in the workplace, and as a person who can influence the adoption of mobile information technology in the organization. Christine, who routinely engages in evidence-based practice, understands the ethical issues inherent in the use of electronic and mobile applications in the workplace, was contacted for an informed discussion of the subject. Also, she is an early adopter for such mobile information technology for the facility. Jim, Deputy Sheriff, was selected for his extensive background in law enforcement handling emergency situations, having served for 19 years. And as a community member whose health care could be affected by the adoption of mobile information technology. The current mobility age presents an opportunity for organizations to capture the power of mobility in order to create competitive edge and improve the delivery of healthcare. The innovative mobile application chosen for this particular project is Crisis Go. It provides users access to their emergency response plans on their mobile devices. By giving the staff the knowledge of what to do in the first minutes of a crisis, the effects of disaster can be mitigated and lives can be saved. Selecting a crisis type prepares an alert to be sent to all predetermined recipients. The text box permits additional information to be transmitted using voice recognition to speed the process. When the alert is sent, the action is date and time stamped. And audible sirens will let recipients know they have received an alert. Even devices set on vibrate or silent mode will emit the siren. Should an imminent threat arise, the app allows for fast access to the emergency response plans and critical operational checklists that are based on crisis type and staff members' role to decrease confusion and response time. Touching a crisis type opens the checklist for handling that specific emergency. Each person can use pop-up text boxes to send safety teams additional information as events unfold. Maps and documents provide visual aids during the crisis, from evacuation routes to CPR instructions. This application helps connect the correct people in the organization with internal and external key contacts, improving communication and coordination efforts by maintaining a single emergency responder contact list for all. Crisis Go also provides instant notifications to the police and fire officials if needed. When you touch a phone number, a pop-up box will allow you to make a call directly from the Crisis Go screen. Communication during a crisis is critical for all staff and administration. With Notice, you can communicate with individuals, groups, or the entire organization. Two-way multimedia messaging allows communication with text, voice-to-text recognition, photos. Departments and leaders and teams and groups can use this fast and effective messaging that keeps everyone informed, improving communication and the flow of the department. The app also allows for live point-to-point video to be streamed to any other team member with the video feature. Video calls allows experts or leaders to see the situation in real time and provide guidance. Broadcast video is stored on devices for instant playback and is also recorded to the server for later view through the reporting console. Mass notifications allow instant communication with unfolding emergency to appropriate individuals or teams, whether it be 50 or 100,000 employees. For leadership, the canned learning system provides the ability to schedule light and medium engagement drills for staff, keeping a constant state of preparedness while meeting the required safety drills, keeping the facility accreditation ready. Utilizing the reporting console, managers can just fill the fields to create incident reports for police, government entities, and state entities. This flexible interactive tool allows for staff also to use their mobile devices to collect information and submit it immediately back to the portal for final reporting. The facility would have a secure portal through which the designated person can access the emergency plans and update them as needed, and push these updates to the staff's mobile devices. The Crisis Go Facilities Audits tool focuses on the identification of facility hazards, access control procedures, emergency operation plan, drills, and exercises. Data collected from audits may be used to assess the safety, security of facilities, and address any concerns that may have been discovered. Through mobile technology and emergency preparedness, we can minimize the risk of injury or damage to staff, clients, and property. The application captures the power of mobility, creating a new value for the organizations utilizing it, and translating that power into value for employees, patients, and families who will ultimately be affected by its use. Technologies for disaster response will be more effective if they were utilized for everyday purposes before a disaster. With this application, staff can be reminded of meetings, special teams, committee meetings, and be in communication with leadership using the Crisis Go application. The setup is automatic and updated daily. Staff often know when incidents are escalating in the department. When help is not near, giving the staff a personal panic button can alert others that they are in need of immediate help. It also provides with a GPS location of the person who's sending the panic. When staff is no longer on duty, they still need to be connected to other family members for their safety. This application can also be used for personal use. You can use it for your children, for other family members. They can send out panic buttons also.